A lot of terms are thrown around when it comes to your Medicare Part D prescription drug coverage. Premium, deductible, copay, prior authorization, to name a few. Let's get you squared away so you understand all the jargon. Number 1 is premium. This is the fixed amount you pay monthly to your insurance carrier to be enrolled in the plan. If you don't pay your premium, you will be disenrolled from the plan, so definitely stay on top of it. Now, sometimes your plan doesn't have a monthly premium. In that case, you don't need to worry about paying anything to the insurance carrier to be enrolled. Number 2 is deductible. A deductible is what you owe for medications before your plan starts to kick in and pay its portion of the cost. It's not a max or a cap on your drug costs. More on that later. Once you meet your deductible, then you will pay either a copay or coinsurance for each of your medications. The plan pays most of the costs after the deductible. In 2025, Medicare has a Part D drug deductible of up to $590. If you're watching this video in 2026 or beyond, the deductible will likely be a higher number. Let's talk about copays and coinsurance next. A copay is a flat dollar amount owed for a prescription at the pharmacy. Coinsurance is a percentage of a drug's total cost, which you pay at the pharmacy. It's up to the plan to determine whether each drug has a copay or a coinsurance, and that's based on which tier the drug is classified in. Let's go into drug tiers now. There are typically 5 tiers that a drug can be listed as. Tier 1 and Tier 2 are usually inexpensive generics. Tier 3 and Tier 4 are usually brand names, but sometimes you'll see a generic listed as Tier 3 or 4. And then Tier 5 is a specialty drug. These are the most expensive medications. As mentioned, the plan will determine what the copay or coinsurance is for each drug tier. Number 5 is max out-of-pocket, or MOOP. This is the big news for 2025. Part D coverage now has a real max, or cap, on your drug costs. It's $2,000 for covered drugs on your plan's formulary list of drugs, including your deductible. Max out-of-pocket is typically a term you see for your medical coverage, but essentially you can now say that Part D coverage has a MOOP. Number 6 is prior authorization. Prior authorization is when your plan requires you to get approval for the continued purchase of a certain medication through your plan. Typically, you'll be able to fill the prescription the first time, but then the plan will send you a letter stating more information is needed in order to get subsequent refills. This is definitely a point of contention in all sorts of health insurance plans, not just Medicare. You might be prescribed a drug that is very expensive, and the insurance carrier needs to confirm if you're taking it for an allowed reason. A perfect example of this is Ozempic. As of 2025, some Medicare Part D plans cover Ozempic, but it can't be prescribed only for weight loss. Rather, it needs to be for other reasons, like diabetes or heart-related issues. But all situations are unique. There is no guarantee your prior authorization will be approved. And number 7, formulary. Every Medicare plan that includes prescription drug coverage has a formulary, which is a list of medications approved by the plan. Not every medication is allowed by every plan, so you need to verify this with your agent, your insurance carrier, or through Medicare.gov. If the drug is not on the formulary, it is not covered. You would pay the full price. But if it is on the formulary, it will be classified typically in one of 5 tiers, as mentioned previously. The insurance carrier will pay their portion, and you'll pay a copay or coinsurance percentage for each medication. Hey, if you like this video, be sure to watch our other videos right over here. Thanks for watching.